Hi and welcome back to Mastering Anesthesia. In this video, we will be learning about measurement and calculation of dead space. This is a continuation of ventilation and dead space video. You can find the link of the lesson in the description below. This is Mastering Anesthesia, so let's go.
Hi and welcome back to Mastering Anesthesia. In this video, we are going to dive further into dead space, its calculation and its measurement. For a video about ventilation and dead space, there's already a lesson done before and you can find the link in the description below. Now, let's go. The first method that we're going to talk today is Fowler's method. Fowler's method can be used to measure both anatomical dead space as well as closing capacity. Closing capacity is the amount of air, the minimum amount of air present inside the lung that will cause small airways in the dependent parts of the lungs to collapse. Fowler's method uses a technique called single breath nitrogen washout. This is not to be confused with the other method used to calculate FRC, which uses multiple breath nitrogen washout. A little useful information here that helps us understand better. Why do we use nitrogen? Well, first and foremost, it is inert. It means that it will not be metabolized, so whatever comes into the lung will come out of the lung without it being changed into other substances. It is present in high concentration. It is about 79% present in the alveolus, so it represents the alveolar gas. It is unaffected by carbon dioxide or ventilation. So when we actually do this Fowler's method, we will be able to plot a graph, and from the graph, we will be able to derive 4 phases. We'll go into each phases. So the setup is pretty simple. You have a person here, connect the mouthpiece, you put it inside the mouth. Here is a valve box. One end of the valve box, you connect it to an oxygen source. At the mouthpiece, you have a sampling tube. This sampling tube is connected to a nitrogen meter, which will be recorded by a recorder. Here is the valve box that I mentioned. So start by having the subject breathe tidal volume of room air. Follow closely. So at the end of normal expiration, the patient will take maximal inspiration, a full vital capacity breath with 100% oxygen. After breathing in full 100% oxygen vital capacity, ask the subject to expire maximally up to its residual volume. So what happens here when the subject exhales, 2 things will happen. The spirometry connected to the valve box will measure the lung volume exhaled, whilst the nitrogen meter will measure the concentration of nitrogen expired throughout the exhalation. I hope you're clear with the procedure, because now we're going to talk about what actually is happening, the concept behind Fowler's method. To help understand better, I would like to illustrate different gases with different colors. You have pure oxygen, colored red, pure nitrogen, colored blue, and mixture of oxygen and nitrogen will give us a mixed color purple. So when the subject breathes in 100% oxygen, the oxygen will fill the conducting airways, the nostril, the mouth, the pharynx, the trachea, and the bronchus. So this part is completely only 100% oxygen. When we reach the lung, this is where the transition zone happens. There is a mixture of anatomical dead space as well as alveolar gas. This transition zone comprises of respiratory bronchioles as well as alveolar ducts. Get this straight. This place has oxygen and nitrogen mixed together because it is a transition zone. Next, I want to bring your attention to the lungs. Okay, so these are the alveolus. So this comprises of only alveolar gas and only nitrogen gas. So these are not dead space. These are alveolar gas. So when we plot the graph, we will have phase 1, which comprises of the conducting airways, phase 2, the transition zone, phase 3 of the alveolus. Remember, we are finding for the anatomical dead space. So the moment when we are in contact with nitrogen, we are in the ventilated portion of the lung. That zone is where we can find the anatomical dead space. So this is the graph of nitrogen concentration against expired volume. Phase 1 is the anatomical dead space gas expired, only oxygen. No nitrogen will be detected here. So from 0 up to this point here, this is phase 1 where only oxygen. No nitrogen is detected in phase 1. Then it comes into phase 2 where we see this upgoing slope. This is a mixture of alveolar gas and dead space gas. So the graph is steep because we constantly can detect the increasing amount of nitrogen being exhaled from the alveolar gas, the ventilated portion of the lung. Phase 2 is where we can pinpoint the volume of anatomical dead space. Where do we find that space? It is the midpoint of the curve where area A is equal to area B. So when we plot a straight line that connects the midpoint where area of triangle A is equal to area triangle B, that line will give you an expired volume which will correspond to the dead space. Next comes phase 3, which is the plateau phase. Here, all the gas comes from the alveolar gas, so the nitrogen seems to be constant, so that's why you can see a plateauing of the graph here. But note that there is only slight upward slope here in phase 3, not entirely flat. Next, when the subject continues to exhale, reaching its maximum expiration, there will be a sudden rise in nitrogen. This will correspond to closing capacity. It is where the volume at which smaller alveoli begin to collapse during expiration. So when they collapse, it pushes nitrogen out of the collapsed alveoli, giving this steep and small upward rise at the end of phase 4. So quick recap of Fowler's method and the graph of nitrogen concentration against expired volume. Phase 1 is only oxygen being exhaled, no nitrogen, so that is why it's at 0. Phase 2 is a mixture of dead space and transition zone alveolar gas. So we take the midline because since it's a mixture, we take half-half. So the midpoint of the area A equal to area B, we take that, plot it downwards to expired volume. This will correspond to anatomical dead space. Phase 3 is a plateauing of the graph because all the gas exhaled now comes from the alveolar gas. So the nitrogen will be uniformly increasing. And phase 4, when the patient has maximally expired, so this will reach the closing capacity of the lungs, the alveoli will collapse, pushing the nitrogen, pushes out nitrogen from the lungs. So this will have this positive inflection at the end of the graph. Next, we shall talk about Bohr Method. This is used to calculate physiological dead space. Bohr Method uses Bohr Equation. So it calculates in ratio of physiological dead space to tidal volume. Mathematically, it is written as Vd over Vt, dead space over tidal volume. The normal range for this ratio is about 0.2 to 0.35. So let's write the equation. Bohr equation is equal to physiological dead space divided by tidal volume is equal to PaCO2 minus PETCO2 divided by PaCO2. PaCO2 is the arterial tension of carbon dioxide. PETCO2 is the end-tidal tension of carbon dioxide. So let's start deriving Bohr equation. Now to derive Bohr equation, we have to base on a certain principle. We are going through the basis that carbon dioxide only comes from alveolar gas, and these alveolar gas are from alveoli that are ventilated and perfused, and we understand that carbon dioxide does not come from dead space. Carbon dioxide only comes from the alveolar gas. So recall from our previous lesson that tidal volume is equal to alveolar volume plus dead space volume. This equation can be rewritten as alveolar gas volume is equal to tidal volume minus dead space volume. Follow me closely now. We want to find the concentration of carbon dioxide. So we define as Fa as fractional concentration of alveolar carbon dioxide. Fe is the fractional concentration of expired carbon dioxide. Fd is the fractional concentration of dead space carbon dioxide. Let's process that for a moment. Next, we take our parent formula here and incorporate the concentration of carbon dioxide by multiplying Vt with Fc is equal to Va times with Fa and Vd times with Fd. Now recall that concentration of dead space carbon dioxide is essentially nil because carbon dioxide comes from alveolar gas and none come from dead space. So we can essentially cancel out the Vd times Fd. Now rewrite the equation and substitute the value of alveolar gas volume into this formula on the right. We will have Vt times with Fe is equal to Vt minus Vd times with Fa. Sorry, the multiplication in the middle there is actually is equal to. So multiplying the brackets, expanding the equation will give us Vt times Fe is equal to Vt times Fa is equal to Vd times Fa. We want to bring this portion forward, so rearranging will give us as such. So rearranging this formula will give us back to the Bohr equation. Vd divided by Vt is equal to Fa minus Fe divided by Fa. Now, partial pressure is proportional to concentration. So we can write the Fa as PaCO2, Fe as PeCO2, and we will get the equation for the Bohr equation. This can be confusing, so take your time, go through this equation again, replay this video, and I hope you'll get it. So there you go, we've reached the end of our lesson today, dead space, Fowler's and Bohr's method. Please like, comment, and subscribe, and I'll see you in the next video.
Thank you for watching. If you find these videos helpful, please hit the like and subscribe button to show your support. Comment down below what topic you want us to cover next. Till next time, see you in the next video.